We can have large hospitals in very large cities, Phoenix being one of them, and LA and Dallas and St. Louis. I mean, they can be big cities, but in the rural cities, you don't necessarily need large hospitals in those areas. But what you need is high quality doctors that can treat patients and everything. So the general practitioner really doesn't exist much anymore, because the medical schools, they don't teach you, and the billing codes do not reward you for your knowledge and for taking care of and making people well. What they pay for are lots and lots of procedures. So the fact is that an orthopedic surgeon makes $1 million a year right out of the bat, where maybe a general practitioner makes somewhere between $100,000 and $180,000. That's a huge difference. Well, what's the difference between the two?
Where did they lose the concept of do no harm? Where did they lose the concept?
The problem is that
being a doctor, do no harm.
Exactly. And that's part of the Hippocratic Oath.
Exactly.
And so one of the things that we've got to do is we've got to sit down and start reinforcing that. We have to have doctors that are making decisions. We have to get the bureaucrat and the politician out of the exam room. Only have the patient and the doctor in that exam room. When the doctor comes out, we have to be able to have insurance companies that are willing to pay for whatever their diagnosis is, but then also their ICD billing codes cannot be only attached to those diagnoses. They need to have the freedom to be able to attach other ICD billing codes that may not fit the norm, because this is not, every individual is an individual. We're not all collectively the same. And so understanding what's taking place and what we're trying to do here is to actually put health back into healthcare. We need to make sure that we treat the illnesses and we get people well. And the thing is that if you have a well person, are they going to be more productive? Will they go to work? Will they be able to pay their taxes? Will they be able to do all these things? Will it actually in the long run affect our economy? Absolutely. And so it's a whole process there, and we can do this because here's the thing. From July, once these protocols are set in place that we have going, we're going to we have a year to give to our senators and to our congressmen all of this empirical data so that they can run on it and they can be reelected, or we can increase in the Senate and the House so that we can be very appreciative of and continue going on. Otherwise, we're going to have a lame duck president like we did in the first term at the end of his term, where nobody was supporting him because he didn't have the House or the Senate. Sure. So we've got to keep that for 4 years. And once we do that, we can make this work.
Well, what kind of work is Elon going to be doing for you guys?
Well, Elon's actually already been working. He has downsized 1/3. So if you went to the HHS and you looked at the organizational chart that we had, it was actually 3 abreast and about 40 down. Now it's 1 abreast and about 20 down. And so they've literally gotten rid of hundreds of jobs, thousands of jobs. And just a week ago, they fired 8,100 scientists that were attributed to the COVID vaccine. They've actually sent out 75,000 people received an email that said that we would like for you to take, would love for you to retire or quit, and we will give you $25,000 severance package to go away. So that they're trying to reduce this.
All right, let me just throw this in here. This is very important. and I got just a couple words. McDonald's is hiring. All you guys that lose your job, we want you. All right? They'll take care of
Absolutely.
you. Ask Donald Trump, it's his favorite place.
And we got the insurance companies that can come in and help you and provide you with really good coverage and doctors that will get you well.